Okay, we're starting the show tonight for the Director of Health for the City of St. Louis Health Department. Pam Walker joins us. Thank you for being here. I alluded to it just a minute ago that we might be breaking the law. Let me read to you Missouri law here. Quote, no public officer or employee of this state shall provide assistance or resources of any kind related to the creation or operation of a federally facilitated health benefit exchange. So here you are on a show about that exact subject. Why break?
Well, you know, Mayor Slay and I strongly believe that the public has a right to know what their health care choices are. We're a very transparent government in St. Louis. We share our data, our emails, our memos, you know, everything's public. Why would I keep one of the most important things of this century secret from the public? It's my job as health director to inform, educate, and assist people in understanding what their health insurance choices are, and that's what we're going to do.
So why do you characterize it that way? Why is it the most important thing of this century?
Because there's a whole new paradigm for health care and how we get it and what it pays for and what it's going to cost that's been unfolding over the last couple of years. But October 1st, it's going to be totally new.
How?
For the first time in their lives, young adults and others who are uninsured because they work for places that don't provide insurance, more and more, they don't have Medicare, they don't have Medicaid, are going to be able to get affordable health care insurance that actually covers something. They'll get preventive care, mental health coverage, pharmacy coverage. You know, a 32-year-old will be able to get all of that if they make $25,000, say, or between that and $15,000, for about $50 a month. And they'll get a tax incentive that covers 97% of their out-of-pocket costs. They break their leg, it's $750. They go to the hospital for 3 days, it's $30,000. You know, for the first time, they'll be able to have peace of mind and have that kind of coverage.
It's going to be more for other people, though, when that bracket starts to go up. Do you really, you said affordable was one of the first things you said. Mm-hmm. You've looked at this. Do you really think it'll be affordable for the masses? Yes,
it is affordable. There are tax incentives for people, families of four that make up to $94,000. So, you know, your alternative is much worse to not have health insurance. And more young people in particular change jobs. They work as independent contractors. They want to start their own companies. They don't want to be bound by, I have to work here because I have to have health insurance. This lets them get that and have the independence. What you're doing is sharing the cost among a pool of people, you know, your age, and it makes it workable.
Those people have to get in the pool, though. I think we're looking at 2.7 million 18 to 30-year-olds who need to buy coverage in these exchanges, presuming those are the healthy people in our country, for this whole thing to work. Do you think that's going to happen? Do you think the St. Louis share of the young people are actually going to sign up?
Yeah, we have a growing young professional population in St. Louis. They're responsible. They, you know, care about their own health. They care about their careers. And when I talk to them, what I hear is they'd like to be able to get health insurance. The number one question we get when we interview people are, what are your benefits?
Okay, back to breaking the law. What are you doing to get that information to them? What's your biggest challenge there?
Yeah, we're going to be doing a lot of things. We're going to have some enrollment sessions on evenings and weekends where we'll have people that can help them enroll. We're going to be working with the small business independent startup companies to try to help them get information about this. And I think it's just a lack of knowledge and a pretty drastic change, and people keep thinking about the system like it used to be. You know, I have a 32-year-old. He pays $150 a month. Doesn't get any of those other coverages. You know, it would be nice for him to be able to get some primary care. And I think the young population here is going to want to do that. You know, you've got working moms too who have kids that are covered under Medicaid. She'll be able to get coverage now. She's at the doctor all the time. It would be nice if she could go for herself.
In all seriousness, before we wrap up, do you fear this is the law of the land? Do you fear any repercussions?
No, you know, if I'm not intentionally trying to break any law, but I am going to fulfill my responsibility as health director. And if someone feels that I'm breaking the law, they have the option to sue under that state law, and you know, we'll deal with that when it happens. Okay.